Ulna bone. In this video, we'll learn about the ulna bone, its anatomy, important functions, and clinical significance. Let's begin. Ulna is the medial bone of the forearm. It consists of upper end, lower end, and a shaft. The upper end presents the Olecranon process, Coronoid process, Trochlear notch, and Radial notches. The Olecranon process projects upwards from the shaft. It has 5 surfaces: superior, anterior, posterior, medial, and lateral. The anterior surface is articular. It forms the upper part of the trochlear knot. The posterior surface forms a triangular subcutaneous area which is separated from the skin by a bursa. The medial surface is continuous inferiorly with the medial surface of the shaft. The lateral surface of the Olecranon process is smooth, continuous as posterior surface of shaft. The superior surface in its posterior part shows a roughened area. The coronoid process projects forward from the shaft just below the Olecranon and has 4 surfaces, namely superior, anterior, medial, and lateral. The superior surface forms the lower part of the trochlear notch. The anterior surface is triangular and rough. Its lower corner forms the ulnar tuberosity. The ulnar part of its lateral surface is marked by the radial notch for the head of the radius. The annular ligament is attached to the anterior and posterior margins of the notch. The lower part of the lateral surface forms a depressed area to accommodate the radial tuberosity. It is limited behind by a ridge called the Supinator crest. Medial surface is continuous with the medial surface of the shaft. The trochlear notch forms an articular surface that articulates with the trochlea of the humerus to form the elbow joint. The radial notch articulates with the head of the radius to form the superior radial ulnar joint. The shaft has 3 borders and 3 surfaces. The interosseous or lateral border is the sharpest in the middle 2/4. Inferiorly, it can be traced to the lateral side of the head. Superiorly, it is continuous with the supinator crest. The anterior border is thick and rounded. It begins above on the medial side of the ulnar tuberosity, passes backwards in its lower 1/3, and terminates at the medial side of the styloid process. The posterior border. The posterior border is subcutaneous. It begins above at the apex of the triangular subcutaneous area at the back of the Olecranon and terminates at the base of the styloid process. Surfaces. The anterior surface lies between anterior and interosseous borders. The medial surface lies between the anterior and posterior borders. The posterior surface lies between posterior and interosseous borders. The lower end is made up of the head and the styloid process. The head articulates with the ulnar notch of the radius to form the inferior radial ulnar joint. The styloid process projects downwards from posteromedial side of the lower end of the ulna. Posteriorly between the head and the styloid process, there is a groove for the tendon of the extensor carpi ulnaris. The triceps brachii is inserted into the rough posterior part of the superior surface of the olecranon. The anterior part of the surface is covered by a bursa. The brachialis is inserted into the anterior surface of the coronoid process, including the tuberosity of the ulna. The supinator arises from the supinator crest and from the triangular area in front of the crest. The ulnar head of the flexor digitorum superficialis arises from the tubercle at the end of the medial margin of the coronoid process. The ulnar head of the pronator teres arises from the medial margin of the coronoid process. The flexor digitorum profundus arises from the upper 3/4 of the anterior and medial surfaces of the shaft. The pronator quadratus takes origin from the oblique ridge on the lower part of the anterior surface. The flexor carpi ulnaris, ulnar head, arises from the medial side of the olecranon process and from the posterior border. The extensor carpi ulnaris arises from the posterior border. The anconeus is inserted into the lateral aspect of the olecranon process and the upper 1/4 of the posterior surface of the shaft. The lateral part of the posterior surface gives origin from above downwards to abductor pollicis longus, the extensor pollicis longus, and the extensor indicis. The interosseous membrane is attached to the interosseous border. The annular ligament of the superior radial ulnar joint is attached to the two margins of the radial notch of ulna. Ossification, the shaft and most of the upper end, ossify from a primary center, which appears during 8th week of intrauterine life. The superior part of the Olecranon process ossifies from a secondary center, which appears during 10th year. It forms a scale-like epiphysis, which joins the rest of the bone by 16th year. The lower end ossifies from a secondary center, which appears during 5th year and joins with the shaft by 18th year. This is the growing end of the bone, clinical aspects. The ulna is the stabilizing bone of the forearm, with its trochlear notch gripping the lower end of the humerus. On this foundation, the radius can supinate and pronate for effective working of the upper limb. The shaft of ulna may fracture, either alone or along with that of radius. Cross-union between the radius and ulna must be prevented to preserve the pronation and supination of the hand. Dislocation of elbow is produced by a fall on outstretched hand with the elbow slightly flexed. The olecranon shifts posteriorly and the elbow is fixed in slight flexion. Fracture of the olecranon is common and is caused by a fall on the point of elbow. Madelung's deformity is dorsal subluxation, displacement of the lower end of the ulna, due to retarded growth of the lower end of the radius. This was a brief overview of the ulna bone, crucial for elbow stability and forearm movement. See you in the next video.